Can genetic testing predict uveitis? Imagine a future where a simple genetic test could help predict who might develop a certain eye condition. While this sounds promising, the reality is more nuanced. Uveitis is an inflammatory condition affecting the middle layer of the eye, and it can be linked to systemic diseases or occur without a clear cause. Researchers have found that genetics play a role in some cases, especially with specific gene variants. For example, the HLA-B27 gene is strongly associated with acute anterior uveitis, especially in people with conditions like ankylosing spondylitis. People who carry this gene, especially those with two copies, tend to have a higher risk than those with just one. Scientists have also developed polygenic risk scores, which combine multiple genetic markers to better estimate the chance of developing uveitis linked to systemic diseases. These scores can be more accurate than testing for a single gene alone. In children with juvenile idiopathic arthritis, a common cause of uveitis in kids, genetic testing focusing on the HLA region can help identify those at higher risk. When combined with clinical signs, these genetic insights can help doctors decide how often to check the eyes and catch problems early before they cause serious vision loss. However, it's important to understand that genetic testing isn't a crystal ball. Uveitis has many causes, including autoimmune responses, infections, or sometimes no clear reason at all. Even with genetic information, doctors still need to evaluate symptoms, perform eye exams, and use imaging to get a full picture. Some studies have used machine learning models that combine clinical data and genetics, but these are still being refined and are not perfect. They can help guide decisions but cannot predict uveitis with absolute certainty. In practical terms, genetic testing is most useful when combined with other information. For people with known risk factors, like those with autoimmune diseases or juvenile arthritis, it can help determine how closely they should be monitored. This way, eye doctors can catch inflammation early and start treatment before vision is affected. So, to answer the question directly, genetic testing can provide clues about who might be more susceptible to certain types of uveitis, especially when used alongside clinical assessment. But it cannot definitively predict when or if uveitis will develop. It's a helpful tool in a larger toolbox, guiding personalized care and early intervention. Always remember, if you have concerns about eye health or risk factors, consult with an eye specialist or healthcare provider who can give advice tailored to your individual situation.